Kylie Gratton, who is a nurse practitioner with Lowcountry Urgent Care, is here to talk to us about what is the very hot topic right now of COVID-19 testing. So, Kylie, tell us what types of COVID testing you guys do and what the difference is and how long it takes to get results, all of that good stuff.
Sure. So we actually have two different types of testing. So we do a nasal swab, which we do send out, and that actually tests to see if you have an active COVID-19 infection. We can also do the antibody test, which is a blood sample that we also send off to an outside lab, and that will just tell us if you have antibodies to the coronavirus, which means you've been exposed or you had it previously. We send those off to an outside lab, and it usually takes about 72 hours to get the results back. Sometimes it can be a little bit more than that, or sometimes it's a little bit less.
Okay. And how is there a cost associated with being tested?
So we can actually test insured and non-insured patients for no cost to them. We are actually, obviously, we are doing it with the CARE Act, which is the Coronavirus Aid and Relief Program, which is where the government and also insurance companies are covering COVID-19 testing and treatment.
Excellent. And is it important to have an appointment to be seen? Where are you guys located, and what are your hours for the testing?
Sure. We're actually a walk-in clinic, so we have two different locations in Beaufort. So we have a Ladies Island clinic, which that is open from 8 a.m. to 7 p.m. Monday through Saturday. We're also open at that location on Sundays from 9 a.m. to 5 p.m. And then where I am right now, we're at the Robert Smalls Clinic. So we're on Robert Smalls Parkway. We're open Monday through Friday, and we're open from 8 a.m. to 5 p.m. So we're just a walk-in clinic. We just encourage people to stay in their cars. They'll let us know that they're here. We'll come out, register them. We also have the ability to do telemedicine visits for patients who are kind of not really wanting to come into the office and are having non-COVID-19 related problems. And we can see any patient out in the car if that makes them a little bit more comfortable.
Okay, and let's touch a little bit on that about people that are not having COVID-19 symptoms, but they do have something else going on. You want to make sure that people are still getting seen. So how tell us a little bit about making that a more comfortable kind of idea for them.
Absolutely. So like I said, we have the ability to do telemedicine. So if people are having, a sinus infection or cough that's not related to a fever or shortness of breath, we can also see them over like a Skype interview or anything like that, and we can call them in medication that way and see them, just because we do know that the coronavirus, it's a new kind of thing. It's a little bit worrisome to people. So some people don't want to be out and about. They're still social distancing. So of course we want to make people feel as comfortable as they possibly can.
Well, that's a great resource for people, truly. So tell us a little bit more about who really should be tested, and when it's time to be tested for the antibodies, when it's time to be tested for the actual virus. How do we know what to do?
Sure. So with the nasal swab, we usually test people who are symptomatic. So they're having cough, fever, shortness of breath. They've had abdominal issues such as diarrhea. We'll do the nasal swab just to see if they have an active infection of the coronavirus. We've seen a lot of people who, say back in February or back in January, said that they had respiratory symptoms. They had a fever. They didn't test positive for the flu, didn't test positive for strep. So we've been doing the antibody test and sending that out to see if they've had obviously been exposed to it. The antibody test is still kind of up in the air about its reliability, but it's definitely a resource that can kind of put ease to some people's minds about the virus.
Well, Kylie, thank you so much for being here to share with us about your testing procedures and your other resources for people who are not thinking they have COVID-19. We appreciate everything you do.
Sure, absolutely. Thank you.